Respiratory diseases like pneumonia, asthma, chronic obstructive pulmonary disease, and lung cancer affect millions worldwide. According to the World Health Organization, lower respiratory infections, including pneumonia, are among the leading causes of death. Pneumonia is a lung infection, which is often caused by bacteria, viruses, or fungi. The alveoli in the lungs fill with fluid or pus, then leads to inflammation and difficulty breathing. Pneumonia poses the greatest risk to young children, older adults, chronically ill, and immunocompromised individuals. Hospitalized patients are also at high risk of getting hospital-acquired pneumonia. Patients suffer from breathing difficulties, fever, chest pain, fatigue, hospitalization, and long-term health issues. In severe cases, hospitalization and ventilatory support may be required. In older adults or immunocompromised individuals, long-term effects can include reduced lung function and increased susceptibility to future infections. Spread of infectious pneumonia, such as bacteria or viral pneumonia, can lead to community outbreaks, increased risk for vulnerable populations, such as infants, elderly individuals, and those with chronic illness. Vaccinations such as pneumococcal, flu, COVID-19 vaccines, avoiding smoking and reducing exposure to air pollution, early detection through routine screenings and checkups. Washing hands and cleaning surfaces is strongly recommended. Good diet, hygiene, and exercise will help keep your body strong. Stay home if you are feeling sick to minimize any extra bacteria exposure.
Do you agree to this interview and know that it'll be used for educational purposes for pneumonia?
Yes.
When did you have pneumonia?
I had pneumonia mid-COVID, so I think it was 2021.
And how did it start?
I had COVID, and it was about 10 days into having COVID that I started feeling funny or I couldn't breathe and I wasn't getting better.
And do you remember what kind of pneumonia it was?
I believe it was bacterial because I think they said if it was viral, they could have treated me for it, and I didn't receive any special treatment besides oxygen.
What were the symptoms?
So it was kind of hard at first because it was COVID, and so I just thought I had COVID and I couldn't really breathe, and I was having shortness of breath and feeling lethargic and not doing much. And then somebody called me and she was checking up on me and she told me that I needed to go to the hospital, and I was telling her, no, I don't need to go. And she was like, please go, my husband has pneumonia right now and that's what it sounds like. And so I ended up going to the emergency room.
Did you have any coughs during that time?
I did, but I think I was in and out of it, so I kind of wasn't really paying attention to how I was feeling. I was just trying to lay there and feel better.
What kind of treatments did you seek or were given?
Well, when I was I had COVID, I was just resting. They didn't really have much for COVID back then, and so I was just kind of resting. And then when I went to the emergency room, they put me on oxygen. And they weren't able, like I said, they weren't able to treat me because they couldn't treat me for the COVID because I was already 10 days into having COVID. So they said it wouldn't really do anything. It was pneumonia now, and they couldn't do anything for it. And so they just put me on oxygen. And at that time, there were no rooms in the hospital. And so I stayed down in the emergency department.
Did you take the treatment home?
I did. They sent home an oxygen tank, and I had to. I lived up 3 flights of stairs, and I got dropped off because the person had to leave, and I had to carry the oxygen tank up by myself, and almost died.
How long until you felt better or normal?
So I was out a total of 6 weeks, and when I got the oxygen, I think I was already 10 days in to having COVID. And so I had I used the oxygen for like 3 or 4 days because I didn't want to get um, dependent on it. So I just tried to wean myself off. And if I needed it, I would use it a little bit. And when I slept, I could not lay down sleeping because I couldn't breathe.
Mhm.
So I had to sit up on the couch and use the oxygen at night.
Mhm.
And then, like I said, I was out for 6 weeks, but I don't really remember how long it took me to recoup. I think they wouldn't let me go back to work until I was certain time frame.
And what did you learn from this experience?
I guess to seek treatment sooner. I wouldn't have even sought the treatment if the person didn't call me
Mhm.
and encourage me to go, because I just thought I was feeling sick and I'd get better.
Mhm.
But it was pretty hard.
Mhm.
Do you agree to this interview and know that it'll be used for educational purposes for pneumonia?
Yes.
When did it start?
This around December 10th, I started with a cough.
Is there any other specifics to how it started, like how it made you feel?
Well, about a week later, I developed lots of phlegm with my cough, and then a week after that, I thought I really was decongesting. I thought that was it. About 3 weeks later, I still had the cough, and it didn't go away. And by that time, I had some chest pain. I had chills. I was super tired and night sweats, and I also had sore eyes. And
Did you notice anything specific about the phlegm that you said you were coughing up, like the consistency or the smell or the color?
yeah, well, it was clear, but it was very thick. I've never had a phlegm that thick, and it had like a burnt type smell.
What kind of pneumonia was it? Do you know if it was bacterial, viral, was it fungal?
Bacteria.
What kind of treatments did you seek?
The doctor prescribed an antibiotic, doxycycline, for 7 days.
Okay. Was there anything else? Any other type of medications?
Well, after I was told to go to my primary doctor, and that was about a week or two later, and he prescribed some cough medicine, some promethazine and Delsum.
Besides the medications, did you have to have any oxygen treatments?
No, I didn't.
No? Okay.
I just needed to get a lot of rest.
And approximately how long did it take for you to feel better or back to normal?
Well, when I saw my doctor on, well, I think it was February 22nd, he told me I was still not feeling up to my normal energy. And he said it would take a couple more weeks before I even began to feel better. And so by, I think it was February 19th, I was able to resume my normal activities, and I was able to go to the community center where I usually go with them to have lunch with the seniors. And that was when I felt well enough that I could go.
And it started somewhere in December, I believe you
Yes,
said?
around December 10th.
Okay, so it took like a solid 3 months or so.
Two 2 months definitely. Yeah, a
Two
little
to
over
3
2
months.
months. Yeah,
Okay.
about 2.5 months. Yes.
And the last thing I would like to ask you, Adeline, is what did you learn from this experience, or do you have any type of advice, perhaps, that you can give to these viewers?
Yes, during flu and cold season, I think it's a good idea. Well, first of all, I need to get plenty of rest. The doctor told me that I need to get lots of sleep. So make sure you get lots of rest. Wear your mask in public, especially where there's lots of people around, and be kind to all your your relatives and friends, because you don't know when you're the one that's going to be sick and you'll need help, because you don't realize it really brings you down.
How did therapies like nebulizers, incentive spirometry, and chest physiotherapy help those pneumonia patients?
Well, the nebulizers, they induce a bronchodilation, which will increase the diameter and the lumen of the smooth muscles of the airway, optimizing the airflow. The incentive spirometry encourages the deep breathing. It resembles a deep breath, like a yawn. The chest physiotherapy will induce vibration, percussion, and posture drainage. Yes, in order to mobilize the secretions in the center of the trachea.
When is non-invasive ventilation like CPAP or BiPAP used for pneumonia patients?
Oh, that is a very easy question, my friend. The CPAP is used in order to increase the FRC, the functional residual capacity. You want to optimize the expansion of the lungs. The BiPAP, you want to eliminate the CO2. So anytime you have a patient who has a high CO2, is how do you Americans say, the hypercapnia, yes. The hypercapnia in order to eliminate CO2. This is when you will lose it.
How did you manage pneumonia patients who developed acute respiratory distress syndrome, also known as ARDS?
Oh yes, it depends on the severity or the magnitude of the damage. If they are not intubated, you are going to try to utilize the CPAP and the BiPAP in order to optimize the oxygenation and the CO2 elimination. If it is too late for that, you have to unfortunately intubate the patient. And once you intubate the patient, you will have to incorporate not only the ARS network protocol, you will have to prone the patient. Prone.
How different is the pneumonia protocol compared to an ARDS protocol?
It depends again, my friend, on the severity of the damage. If you can induce the chest physiotherapy and prevent the septicemia and the acute lung damage, then you will treat it somewhat different. But once they're in full-blown ARDS, you have to follow the ARDS protocol. If not, you can incorporate the chest physiotherapy, the hyperoxygenation, and the inflation.
What steps can people take to maintain good health and prevent pneumonia?
Oh, that is very easy. Don't smoke. Don't smoke. Don't smoke cigarettes. Don't smoke cigarettes. Stay very active. Deep breathe. Meditate. Minimize your stress levels. That is very important. Eat a very healthy diet. Practice good hand hygiene. Don't get the infections. Don't bite your nails. Don't put your fingers in your mouth. And manage chronic conditions like diabetes, the asthma, or the heart disease.
How important are vaccines like pneumococcal and flu vaccines in aiding preventing pneumonia?
Yes, this is very important, especially in the elderly population. The elderly population has a higher risk and proclivity to be infected with the Streptococcus pneumoniae. So you want to help the vulnerable populations. So these vaccines are very important.
Have there been any recent advancements in respiratory therapy for pneumonia patients?
Oh yes, of course. The first line of defense or therapy, or the modality as you Americans call it, is the high flow nasal cannula. You want to utilize the high flow nasal cannula before you ever intubate. In addition to that, you can use a portable ultrasound. Ultrasound, yes? You understand ultrasound?
Yes.
Yes, ultrasound, yes. It's good for bedside long imaging to monitor the parameters. In addition to that, the artificial intelligence tools are becoming more advanced, and so you can detect the pneumonia from the chest X-ray and the MRI.
How have new infections like COVID-19 changed the way respiratory therapists manage pneumonia?
Yes, that is a good question. They changed the modalities and the therapeutic intervention now. Instead of intubating immediately, they are going to try to do early proning as well as the high flow nasal cannula over any early intubations. Heightened use of the telemonitoring as well is very, very, very important. And then on top of that, stricter infection control management.
As before mentioned, with lifestyle changes, as quitting smoking and pulmonary exercises, are there any other lifestyle changes that you would recommend in reducing pneumonia?
Of course, like I said, you have to quit the smoking, the cigarettes. You need to increase your physical activity. You need to do more pulmonary exercises, like diaphragmatic breathing. That is like meditation. This is like the pursely breathing. In addition, you need to increase your hydration. You want to increase your fluid intake. Not the fluid intake of the alcohol, not the ethanol, but the water, the mono, how do you Americans say it? The dihydrogen oxide. The water is very, very good for you. And then you want to eliminate the excessive alcohol. Moderation.
Researchers have developed a machine learning approach using electronic health records to identify 5 distinct clinical states in pneumonia patients, which can help predict outcomes and guide treatment decisions. Professionals have learned to take these techniques and implement them in ways to improve chest X-ray accuracy, leading to more efficient methods for diagnosing pneumonia. There are many big-name medication treatments for pneumonia, such as amoxicillin and doxycycline. However, recently, the FDA has approved a new antibiotic, a pathogen-targeted therapy known as Zacduro, which specializes in treating hospital and ventilator-acquired bacterial pneumonia. We encourage you viewers to always do your own research, to gather information about the disease, the risks, treatments, public health interventions, the costs, and so on and so forth. To be aware of the measures that need to be taken, not just for yourself, but for your loved ones as well. It is always wise to be able to advocate for yourself or someone else if need be, for it could be the difference between you and a very difficult decision ahead. We recognize that it's slow growing. However, we encourage you viewers to advocate for better policies because it only improves our healthcare outcomes and engagement. To better promote equitable access to care, ultimately leading to systemic changes that would improve health outcomes for everyone. Thank you.